Hey guys, welcome to this session again, and this is Vincent Obita. We are continuing with the new Osce stations, and I'm going to still cover the evidence-based practice stations. And now I'm going to cover the smoking cessation scenario. Similar with other scenarios under evidence-based practice, you are provided with a scenario. Then you are given an article summary, and you are expected to make a summary of the main findings from that research or whatever that is provided to you. So I'll just read out the scenario and the article summary. Then together we can develop the notings that we will write in that article summary. So in this case, I have a patient. And for this case I'll call him Simon Walton. Is attending his GP practice for advice regarding smoking cessation. Please provide him with a summary of the latest evidence on the same. And the article summary you are provided with is recent studies suggest that in trying to give up smoking, e-cigarettes are more satisfying, into bracket 65%, than nicotine replacement therapy, 35%. However, there is no particular replacement therapy that has been found to be as pleasurable as smoking itself. For the e-cigarettes, e-cigarettes appear to have a higher success rate than the nicotine replacement, in resulting in patients being able to stop smoking. Although it has been reported that there is a tendency to cause soreness and discomfort to the mouth when using e-cigarette, unlike the nicotine replacement. A reported side effects of the nicotine replacement is the increased incidence of nausea, and recommendations for patients wishing to stop smoking are to seek professional support with face-to-face contact from local services, as without this help, there is low success rate for either of the treatments. Giving up smoking is widely recognized as an important step in improving health status, and all the health professionals will support and encourage this in promoting patient outcomes. So for this case, that's the article summary you've been provided with. It comes in form of a research finding or research recommendation. Now you are supposed to make to jot the main points that will act as the advice you are supposed to give this patient based on the latest evidence. With this one in consideration, the manner to which you can jot these findings or advise the patient on the latest evidence, this is how you can present it. You can say it is reported that replacement therapies have lower satisfaction levels as compared to smoking. On the other hand, e-cigarettes have 65% satisfaction against 35% of replacement therapy. In stopping smoking, e-cigarettes seem to have higher success rate than nicotine replacement. However, reports also shows that using e-cigarette causes mouth and throat irritation as compared to nicotine replacement that causes nausea. It is important then to note that there is low success rate without face-to-face support for both of the treatments. You therefore need to use the local smoking cessation support services through face-to-face appointments. It is recognized widely that giving up on smoking is a significant step in improving one's well-being, and the entire healthcare team will grant you the required support in ensuring you get the desired results. With that one, you would have provided this patient with the latest summary on the findings of that research, and that's what is expected of you in Osce. Just make short notes from the article summary you've been provided. Provide it in summary form, but ensure you capture all that I've stated, because all this that I've just stated are all in the marking criteria, and you should not miss any content outside the marking criteria, as that's the baseline of all that is expected of you, and you should write it as quick as possible to be within the 10 mark limit. Thank you so much, and bye as we cover the next session of other Osce scenarios. Bye for now. See you then.